In the middle of that spiral is the thing you can't see is called despair. So it's kind of sitting there right in the middle. One little ray of hope among others. I read, probably a lot of people probably saw this, a tiny little news blurb. Someone did a very small study. They were able to show, I'm not 100% sure by what means, but they were able to show that after 2 weeks of abstinence from alcohol, damage to the brain that was a direct result of the alcohol use was beginning to repair and being mitigated. So in anybody who works in a substance abuse program, they might be able to agree with me because I tend to see that in my program. Sometimes after about 2 weeks, I see the lights go on in some of my patients. And frankly, in psychotherapy for that first 2 weeks, they have been useless. I've been drinking every day for 1.5 years, and we go to psychotherapy, and they're there, but they're not there. And insight is not happening. They're not remembering things from day to day. So think about the ability of that person to use their reflective reward system and think about all the big consequences of having another drink. They can't. They're having a tough time with the basics. But if you can stay sober, some of that stuff, maybe, according to this tiny little hopeful news blurb I read, might start to come back online, maybe put you in a better place. Meanwhile, we get the real world because our patients are entirely too rude to read the book before they decide to present for care. So lots of folks never really come in saying, yeah, doc, the only problem I have in my entire life is that I drink too much. That's it. Everything else is perfect, right? No. So most of our patients are comorbid. That is the norm. They are depressed. They are anxious. Now, can you prove that their illness was not caused by the drug? Most of the time, no. But the fact is, they are going to present most of the time with significant mental illness and a significant substance use. One may be feeding the other. They may be feeding each other. Also, when actively using, severely increased risk of suicide. I'm going to touch on that again on Sunday. Everybody's coming on Sunday, right? Yes. Thank you. And increased risk of suicide, impulsive aggression, lots of violent, scary things can happen that lead to bad outcomes when people are using. And again, that reflective reward system is becoming less and less active. Their ability to think is less and less active, and they're already mentally ill. So what are you going to do about that? Well, ideally, integrated treatment, right? Doesn't it seem like the most obvious thing in the world? Well, A, you're going to get this guy sober, and B, we should be treating a mental illness while we're doing that. Yes, I agree. I don't know how many times it's actually a realistic thing, but yes, I agree. I wish that we could do that. That I actually kind of hit the jackpot when I got my last job. We are able to do that because we're an inpatient setting. Unfortunately, inpatient settings are a little bit rare. Like if anyone remembers how they kind of went away before I was a resident. Depending on the severity, you might have to do treatment one then